Hello everyone! Magandang araw po sa inyong lahat, sa lahat ng nag-sign up dito sa aming FB page na Lockdown Mindcare Challenge. Welcome po! Ako po si Dr. Querubin, isa po akong psychiatrist and at the same time, nagsisilbing Chief Medical Officer ng Mindcare Club. Ito pong Lockdown Mindcare Challenge ay ginawa namin para matulungan tayong lahat na masustain at mag-survive dito sa isang buwan na lockdown. Tayo pong lahat ay nasa ating mga bahay at for sure, naaapektuhan ang ating mental health habang tayo ay dumadaan sa prosesong ito. Ang page na ito ay para sa inyong lahat na sana makatulong sa inyong sustained mental health at makatulong din na mag-enjoy tayo kahit papaano habang nasa ating mga bahay. So welcome po sa lahat ng sumali sa Lockdown Mindcare Challenge. The COVID-19 virus is new. Many things about it are unknown. And those are the factors that can drive anyone to the highest levels of anxiety. But add to that the fact that it is not only new and largely unknown, it is also invisible. Yun yung dahilan kung bakit lahat ng tao nag-worry. And I think we have to underscore the fact that we don't have to have an anxiety disorder in order to feel anxious at this point in time. All of us, you and I, are experiencing a certain sense of fear or worry or anxiety because of the virus. The fact that it is invisible and it is unknown will make us really think and ask so many questions that at this time have no answers. So that collective anxiety is shared by everyone in the global community at this point in time. Hindi lang to sa Pilipinas, hindi lang to sa mga bahay natin. Ito ay isang bagay na ipinag-aalala ng buong mundo. So, if you are worried, if you're unable to sleep at certain nights, do not think that it is an abnormal reaction. It is a very real and normal reaction given the COVID-19 that is here in front of us. Hindi lang siguro yung fact na bago siya at invisible. Idagdag pa natin dito na hindi natin alam kailan siya matatapos. So we have to stretch ourselves a bit more and be resilient and do something about the fear that we are feeling at this point in time. But I guess what I'm trying to emphasize is the fact that if you are feeling that kind of emotion, we're all in it together. So how do we manage the collective anxiety? One of the best ways talaga by which we can handle the fear or the anxiety that we are feeling at this point is to just focus on the here and now. Huwag na natin pag-usapan anong mangyayari mamaya o anong mangyayari bukas kasi hindi natin pare-pareho alam. So siguro, when we say focus on the here and now, we can start from the moment we wake up in the morning. We can ask ourselves, so if this is the only day I have to do or I have for myself, what is it I'd like to do? Anong gusto mong gawin? Anong gusto mong kainin? Sinong gusto mong kausapin? You know? Because when we start thinking about those things or answering those questions, we can concretely do something about our own anxiety and we can make ourselves feel much better. Tapos siguro yung isang aspect that has to do with the lockdown and the social isolation is that the only thing that has been taken away from us by this lockdown is our physical contact and our contact in the context of an outside world. It does not stop us from being relational human beings. It doesn't stop us from reaching out to other people or letting others feel or know what's happening to us. It doesn't stop us from letting others know that we care about them. I think the interesting part about being in this phase of social isolation is it calls on all of us to think about new and exciting creative ways of what we call language of love. It doesn't stop us from loving or caring for other people. It should motivate us to find new ways of saying I love you and I care about you. I guess that's a nice thing to do, right? Another way of dealing with the crisis that we're going through at this time is to draw on our capacity to be empathetic and kind. At meron akong, I think, gustong emphasize na dalawang levels about the act of kindness. Unang-una siguro, to take care of ourselves, we also have to be kind to ourselves. We cannot push ourselves too much, or if we are feeling bored or annoyed or upset about being locked down, we have to give ourselves some elbow room to feel that way. It is okay to be annoyed. It is okay to be upset. What do we want to do about it? And then other level of kindness is paying attention to other people and maybe doing acts of kindness that actually address the needs of others. So if you notice, when we start going out of ourselves and helping other people, we also forget our own worries. We also feel good about doing something that will ease the pain or suffering of another person. We forget our anxiety. So by helping others, we also help ourselves. So I think if there's one thing we should remember, we have to be kind. So those are my thoughts regarding the COVID-19 epidemic that we are experiencing. So I'd like to thank everyone who signed up for the Lockdown Mindcare Challenge. I also ask you to invite your friends and your families to join us. And on behalf of the Mindcare Club, I'd like to wish everyone to stay well, stay safe, and let's all see each other at the finish line. Maraming salamat!